This is our Education on Chronic Disease Management presentation on osteoporosis by Kevonique Charlton, Jackeline Duarte, Lindsay Malaquias, and Kenley Hubert. This is our group photo with Jackeline Duarte, Kevonique Charlton, Lindsay Malaquias, and Kenley Hubert. Introduction to osteoporosis. Osteoporosis is a medical disorder characterized by brittle bones that become more porous and less dense, thus making those with osteoporosis prone to fractures even under minor stress or damage. Bone weakening can result from age, hormonal changes, nutritional deficiencies, medications, or even genetics, leaving bones fragile and vulnerable. Managing osteoporosis is essential for various reasons. Weak and brittle bones are more prone to fractures, resulting in a lower quality of life. Managing osteoporosis can assist in preventing these fractures. People can continue to maintain their mobility and participate in regular activities. Osteoporosis can substantially influence a person's quality of life because of pain and limitations in physical activity. Effective management can reduce symptoms and enhance overall quality of life. Causes and modifiable risk factors for osteoporosis. Aging is a key risk factor for osteoporosis because bone density typically diminishes with age. For example, as people age, their bodies may become less efficient at absorbing calcium. This can cause gradual bone deterioration over time, increasing the risk of osteoporosis. Hormonal changes, especially in women, can lead to osteoporosis as well. For example, in menopause, women's estrogen levels drop. This hormonal change might accelerate bone loss, causing women to be more prone to osteoporosis. Poor nutrition, such as an inadequate intake of calcium and vitamin D, can weaken bones and increase the risk of osteoporosis. For instance, a diet low in calcium-rich foods like dairy products, leafy greens, and fortified foods can compromise bone health over time, leading to reduced bone density. Lack of physical activity, especially a lack of weight-bearing exercises, can contribute to osteoporosis. Weight-bearing exercises like walking, running, and dancing promote bone health and density. Certain medications and underlying health disorders can raise the risk of osteoporosis. For example, long-term use of corticosteroids, which are often recommended for illnesses such as asthma, can weaken bones. Some lifestyle choices may damage bone health and contribute to osteoporosis. For example, heavy alcohol intake and smoking have been shown to weaken bones and increase the risk of fractures. Alcohol impairs the body's ability to absorb calcium, whereas smoking alters hormone levels and lowers bone density.
So I'm going to talk about signs and symptoms. Osteoporosis is considered a silent disease because there's no typically signs until a bone is broken, which means that sometimes a person go to the hospital with a fracture and the healthcare providers and the team run some tests, specifically an X-ray, to measure how many grams of calcium and other bone minerals are into the bone. And if this number is low, the person can be diagnosed with osteoporosis. After that, some later symptoms can be frequent bone fractures, loss of height, back pain, poor posture, and joint pain. Now I'm going to talk about management and treatment for osteoporosis. Some treatment options include dietary changes, exercise, lifestyle changes, fall prevention, supplements, and some medication. For the dietary change part, you can include plant proteins such as beans and nuts, as well as animal proteins such as fish and lean cuts of meat. The plant protein part is because it's good and rich in vitamins and minerals and can help preserve the bone. The person can also add low-fat dairy products including milk and plain yogurt because those are a good source of protein as well, and they contain calcium. You can also add olive oil, soybeans, and blueberries because they're good in omega-3. And for the exercise part, The person can do weight bearing and impact loading exercise such as dancing and walking. You can also use free weights, and you can use your body weight resistance or weight training machines to help with that. And it's recommended for a person to do 2 hours to 2 hours and a half of exercise weekly. And for the medication part, we have Bovina, Actonel, Fosamax, and Reclast, and you can add vitamin C and D in the treatment as well. Those are biophosphonates. They can help improve the bone density and makes the bone stronger and help prevent fractures and pain.
Hi, my name is Kenley, and I will be discussing the importance of healthy lifestyle changes associated with osteoporosis using the Creation Life template. We make choices every day, and those choices can either positively impact our health or negatively impact our health, especially in chronic conditions such as osteoporosis. A good choice does not have to be elaborate. They can be as simple as walking your dog or tending to your garden, both of which are beneficial to your bone health. Second is rest. Rest can allow the body to effectively rebuild bone minerals which are lacking in individuals living with osteoporosis. At least 8 hours is encouraged. Next is environment. Outdoor environments such as parks, nature reserves, and beaches can encourage one to exercise and receive vitamin D from the sun. Next is activities. Weight-bearing exercises throughout life are now recognized as the most effective measure to maintain bone health. Next is trusting in God. Allowing God to be your strength can give someone the encouragement they need to make good choices. Next is interpersonal relationships. Friends, families, churches, and support groups can greatly help individuals living with osteoporosis. Next is outlook. Having a positive outlook can increase one's outcome. Looking at life through the eyes of half full can bring fulfillment in one's life. Lastly, nutrition. Increasing intake of vitamin C can slow the progression of osteoporosis, which can lead to less fractures and breaks, which means less time at the hospital and more time with loved ones.
Hi, my name is Kevonique Charlton, and I will be speaking about preventative measures of osteoporosis. Preventing osteoporosis is also known as primary intervention. This includes eating foods or drinks that are rich in calcium, such as milk, broccoli, kale, oranges, apricots, almonds, and sardines. Foods with vitamin D can also prevent osteoporosis, such as tuna, mackerel, salmon, soy milk, orange juice, cheese, and egg yolk. Exercising and avoiding the use of alcohol also has great prevention effects. Detecting and preventing osteoporosis in its early stage is also known as secondary prevention. This can be done with screenings and examinations to measure bone density through imaging tests, hormonal therapy, weight-bearing exercise, and calcium supplements. Preventing disabilities and fractures from osteoporosis is also known as tertiary preventions. They include the use of medications such as biphosphonates, which are aldronate, risedronate, ibandronate, and zoledronic acid. These medications slow the breakdown and removal of bone.
Hi, my name is Kenley. Individuals living with osteoporosis may feel alone and overwhelmed. In this slide, there are links that can help people understand the disease process, medical cost assistance, and support groups.
Below is the references that we used for this presentation.